Hi, this is Dr. Fazeli. I'm a geriatrician in Southern Maine, and I'm recording this video for medical directors, DONs, and nurses that are working in nursing homes and assisted living facilities. This is to address what is done differently for COVID-19 preparedness that's pertinent to nursing home setting. The first item of discussion is what to do with hypoxic respiratory patients that you can no longer send to the hospital if there is no bed availability. The first thing about those cases is the need to know that we cannot use BiPAP or CPAP machines because those machines aerosolize the virus and they will turn our droplet precautions ineffective because with aerosolized virus, you need negative air pressure, you need full respiratory precautions, which we do not have in that setting. So you can't use either of those, BiPAP or CPAP. By the same token, you cannot use NEBs either, and we can discuss that in a bit. What we can use is three things. A standard nasal cannula, which all facilities have, which we can crank up to 6 liters. And then the next level is oximizer pendants, which will give you intermittent higher flow of oxygen. And then the third tier, or the highest, would be non-rebreather mask, which you could use with 10 to 15 liters oxygen. So that would be your highest possible in your setting. If somebody needs a BiPAP or CPAP, they need to be intubated and vented, and they need to be in the hospital. The second thing I want to cover is staffing and routine care. So we've been trying to take away some of the tasks so that the staff can do more with their time. The one task that you can think about is the vital sign check. So if you're doing vital signs on everybody, every shift to monitor for COVID-19, you could consider doing temps only and doing more on cases that are having symptoms or have other reasons for you to target them for more testing. Routine work that you're doing, like showers. I've asked my directors of nurses to divide the residents into three categories. Category 1, people who can do sponge baths that can be independent enough to do them with little or no help. The second category is those who cannot do sponge baths but can have reduced number of showers per week without compromising care. And the third category is the few that remain that have to have the same intensity of showers and care. I think going about it systematically like this, you could free up time on a systematic way and not wait for people to anecdotally decide on a case-by-case basis. With regards to nebulizers, NEBs can aerosolize the virus, so in suspected cases, you have other alternatives. The obvious alternatives, albuterol and combivent inhalers, which you have to use with spacers. And the need for spacers is obviously for the dementia patients who cannot effectively use the inhalers due to their dementia. The other option, which is not frequently used, is the albuterol tablets. Albuterol comes in 2 milligram tablets that you can give orally. You can crush it, you can give it whole, you can use it scheduled, you can use it PRN, and that's an option. So those. The other item of discussion is fever. So I want to address the PRN standing order for fever in nursing homes and assisted living. This needs to be suspended because you do not want fever to be treated routinely with Tylenol without a call to the doctor or nurse practitioners. So if you don't have specific requirement to call the doctor, with any fever, you need to suspend your standing order with regards to fever. The other item around fever is the use of dipsticks. I strongly suggest stopping the use of dipsticks in general, but specifically for this case, around COVID-19 is that if you have a case with fever and the staff are used to testing with dipstick, they can get a positive test and stop looking. And that can send you in the wrong direction. Many of our residents have asymptomatic bacteria. Your dipstick has 1 in 2 chance of being positive. So having a positive dipstick may distract you from a workup for the fever under our circumstances right now. The other thing I want to discuss is admissions from the hospital. So I've been doing more screening with any respiratory cases. I suggest every medical director and admission coordinator do so, and the administrators should look for their medical directors to have final say on admissions that are suspect. I know that's not the normal routine under normal circumstances, but this is not normal circumstances. You need to use the medical directors to their highest skill, which is being able to triage, screen, tell you if they recommend COVID-19 testing before admission or not. The other thing I want to mention is around testing. So if you have tests that are coming either for your staff or for the residents, you need to know where they're going. So if a test, especially in assisted livings, if they send the test to the state lab, that state lab is going to take a week, despite the fact that they're prioritizing nursing home residents, which we appreciate. If you need the results, which we always almost need, you need to send it to your commercial lab, Nordex, but you need to call them. You need to specify that it's a priority test. You need to call them in advance to tell them it's coming so they don't ship it out of state as a second tier. I'm hoping that with test availability, that will no longer be an issue, as Nordex will be able to meet everybody's need without having to use a tier system. And I'll take the opportunity to thank every lab technician who's helping us and risking his life doing this work. With regards to staff testing, if you send your staff member to outside labs, they're not going to get test results same day. Almost guaranteed, under the circumstances of shortage, they're not going to get it. Your best bet is to test your staff member in your parking lot, fully gowned in masks, and send that test to your Nordex from your facility through your regular drop system or pickup system, and prioritize it and mention that it's a healthcare provider so that they can do it in-house. That's all I had to cover. I hope you find it useful. If you have more specific questions, please email me or go to the AMDA website. You don't need to like, you don't need to subscribe. Just stay safe. Let's roll.